When it comes to managing diabetes, most people think of just three things: cutting carbs, taking their medication on time, and checking their blood sugar every day. And yes, those things are important. But after more than 30 years of working with diabetic patients, I've learned there's one silent factor that many overlook. Minerals. Minerals aren't as obvious as sugar or starch, but they're the foundation of countless processes in the body. They help insulin work properly, support the movement of glucose into cells, protect your nerves, regulate your heartbeat, reduce inflammation, and prevent serious complications affecting the eyes, kidneys, and heart. The sad truth is, most people with diabetes are deficient in key minerals like magnesium, zinc, or chromium, often for years without even knowing it. And when the deficiency lingers, the body starts to speak up: constant fatigue, leg cramps, numbness or tingling, intense sugar cravings, or blood sugar that swings up and down despite stable medication and diet. As we age, our ability to absorb minerals from food declines, just as our need for them increases due to rising oxidative stress and accumulated cell damage. So if you've been doing everything right but your condition still feels off balance, you might be missing one vital piece of the puzzle: minerals, the silent heroes in your diabetes journey. 1. Magnesium, the quiet companion for blood sugar stability. You may not notice it, but every time your blood sugar spikes, your kidneys work overtime to flush out the excess sugar. The problem: magnesium gets washed out right along with it. Over time, many people with diabetes become magnesium deficient without realizing it. Magnesium acts like a quiet coordinator, helping insulin bind to your cells so glucose can enter and be used as energy. Without enough magnesium, your body becomes insulin resistant. Glucose stays in your blood instead of getting inside your cells. The result: blood sugar rises, energy drops, and fatigue sets in. Have you ever had nighttime leg cramps, tingling hands or feet, heart palpitations, difficulty sleeping, or unexplained anxiety? These can all point to magnesium deficiency. It affects your nervous system, disrupts restful sleep, increases stress, and even lowers libido, something few talk about, but many older adults experience. The good news is, magnesium can be replenished naturally. Pumpkin seeds, steamed spinach, almonds, ripe avocado, and a square of quality dark chocolate are all excellent sources. If you enjoy cooking, try miso glazed salmon with spinach or almond crusted cod, delicious and rich in magnesium. However, be careful of magnesium thieves like refined sugar, excessive caffeine, alcohol, processed grains, and high calcium supplements, which block magnesium absorption and worsen deficiency, in some cases especially if you're dealing with sleep issues, nerve sensitivity, or muscle cramps. I recommend supplementing with magnesium glycinate or bisglycinate, which are highly absorbable and gentle on digestion. Unlike common forms like magnesium oxide, magnesium deficiency isn't just uncomfortable, it's quietly damaging your heart, your nerves, and your ability to manage blood sugar. Don't let your body keep crying for help in silence. 2. Zinc, a tiny mineral with a massive impact on diabetic. I once treated a gentleman in his 70s who lived very mindfully. He ate well, tracked his blood sugar, took his meds, yet his skin wounds healed slowly. He kept catching colds, and recently he told me everything tasted bland. Tests revealed a surprising cause: severe zinc deficiency. For people with diabetes, zinc is like a silent gatekeeper. It helps the pancreas produce and release insulin, boosts immune defense, reduces inflammation, speeds up wound healing, balances hormones, and protects nerves, the heart, kidneys, and eyes. But diabetes causes the body to lose zinc through urine more rapidly, and the signs often go unnoticed. Zinc deficiency shows up as small but significant issues: delayed wound healing, frequent infections, intense sugar cravings, hair thinning, reduced libido, disrupted menstrual cycles, or loss of taste. Many chalk these up to just aging, but it's your body asking for help to restore zinc. Start with food. Oysters are the richest source. Just 3 medium ones provide over 200% of your daily needs. Beef liver, pumpkin seeds, lean beef, and chickpeas are also great. For something elegant, try oyster sashimi with ponzu sauce, beef tartare with quail egg, or grilled lamb chops crusted with pumpkin seeds. Meals that nourish both body and soul. But take note: refined sugar, alcohol, processed foods, high-dose calcium, and unsoaked whole grains which contain phytates can block zinc absorption. Even with a good diet, these habits may keep your levels low when needed. I often recommend zinc picolinate or zinc bisglycinate, 2 forms that absorb well and are gentle on the stomach. A typical dose is 15 to 30 milligrams per day, but if taken long-term, it should be balanced with copper to maintain mineral harmony. Zinc may not be as talked about as insulin or blood sugar, but it's the key to keeping your whole system running smoothly, from immunity to hormones, from the heart to the nerves. Don't let a quiet deficiency slowly unravel your health. 3. Chromium, insulin's unsung partner. There's something not many people realize. Insulin can't do its job alone. It needs a silent but essential partner, the mineral chromium. Think of chromium as the key that helps insulin unlock the door into your cells, where sugar can be converted into energy. Without chromium, that door becomes harder to open, and glucose gets stuck in the bloodstream, causing your blood sugar to rise. For people with diabetes, especially when blood sugar is unstable, the body tends to flush out more chromium through urine. Over time, this creates a silent deficiency that often goes unnoticed. The signs: you may feel tired for no clear reason, irritable, low in energy, crave sweets, or struggle to focus. Some people experience nerve issues, poor circulation, numbness in hands or feet, or even fertility problems. In the long run, a lack of chromium weakens insulin's effectiveness. Your pancreas has to work overtime to produce more insulin, which leads to worsening insulin resistance and faster progression of type 2 diabetes. You can replenish chromium naturally. Broccoli is one of the best sources. Just half a cup can provide up to 50% of your daily needs. Brazil nuts, lean beef, eggs, and even grape juice in moderation. Due to sugar also contain meaningful amounts. If you enjoy flavorful dishes, try Wagyu beef stir-fried with broccoli, grilled lamb with grape sauce and steamed asparagus, or duck liver péti with poached egg and truffle mushrooms. Gourmet meals that nourish your body too. But beware of chromium's silent enemies: refined sugar, white starches, alcohol, and high-calcium dairy supplements. Calcium competes with chromium for absorption in the gut, making deficiency worse. If symptoms of deficiency are evident, supplementing with chromium picolinate or chromium polynicotinate at a dosage of 200 to 500 mcg day can be helpful, but always under medical supervision. Chromium may not make headlines, but it plays a vital role in blood sugar regulation and protecting you from silent complications. If you feel like you've done everything right but still aren't in control, ask yourself, could I be low on chromium? For selenium, the quiet anti-inflammatory mineral. I remember a consultation a few years back. My patient was a 67-year-old man. Outwardly he seemed healthy, his diet was reasonable, and his blood sugar was within acceptable range. But he constantly felt tired, caught frequent colds, had dull skin, and whenever he got a scratch healed slowly. A deeper look at his labs revealed something surprising. He was deficient in selenium, a tiny mineral with a big job, especially for people with diabetes. Selenium is a powerful natural antioxidant. It helps neutralize free radicals created by high blood sugar over time. Even more, it supports your thyroid, an organ essential for regulating metabolism, energy, and even mood. When you're low in selenium, your body struggles with chronic inflammation, infections, and slow healing. Small cuts take forever to close. A simple cold lingers. And silently your risk of cardiovascular complications, nerve inflammation, or even thyroid damage goes up. In people with type 2 diabetes, chronic, low-grade inflammation is a hidden enemy, worsening insulin resistance day by day. Selenium is one of your quiet bodyguards in that fight. The good news, you don't need much. Just 1 to 2 Brazil nuts per day will meet your selenium needs. Other good sources include tuna, sardines, eggs, and brown rice. Easy, safe, and delicious ways to keep your selenium levels balanced. But selenium is unique. Too much can be harmful. If you're using supplements, choose one that contains 50 to 200 mcg per day, and never exceed the recommended dose without your doctor's guidance. Among all the minerals, selenium is often forgotten, but if you're living with diabetes, selenium isn't optional. It's essential for your long-term wellness. It could be the quiet shield standing between you and the complications you hope to avoid. Final thoughts: as you can see, good health isn't always about the big things. Sometimes, a small deficiency in magnesium, zinc, chromium, or selenium can throw your entire system out of balance, making it harder to manage blood sugar and avoid silent complications. After more than 30 years working alongside people with diabetes, I've come to understand that healing isn't just about taking medicine. It's about nourishing your body the right way, a little bit at a time, every single day. And it all starts with knowledge, small but powerful insights, like the ones you heard today. If this video brought you clarity or hope, please don't hesitate to like, subscribe, and share it with someone you care about. Because sometimes, one piece of information is all it takes to help someone live healthier, with more peace and confidence in their diabetes journey. Thank you for staying with me until the very end. I'll see you in the next video, where we'll continue exploring how to live strong, live intentionally, and live well in our golden years. Wishing you peace and lasting health.